Okay.
Gut loading that we've been feeding to the crickets. At first I started doing the dusting, which seemed to be kind of weird to do. But
Right.
the gut loading seems to be working great, at least for the crickets. Now if I can just
Right.
get Momo to eat them, it'd be
Right,
perfect.
exactly.
And I did have a question. I mean, should I be doing both?
I would
Gut loading
recommend
and
both.
dusting?
I
Okay.
would recommend both. And you have the light that you have is a UVB
Yes, it's
light?
a Retina
Okay.
Sun 10.0, 24-inch
Perfect.
tube.
Perfect. And you know to change that every 6 months?
Mhm.
Perfect.
Oh, yeah, we did a lot of research.
Excellent. That is good. Alright, bud. I'm pretty lethargic.
He was up moving around a few minutes ago.
With basically kind of a broad spectrum anti-parasitic, but ideally we like to know what type of problem is going on, so still getting a fecal at the next time would be good. We'll do one more heart rate so you can... Nice and strong. Climb up a little bit. Just kind of sitting low. I would still recommend some soaking one to help him out with the shed, but you are going to have to watch him because he's just not holding up his head very well. So putting his head up onto something, they can drown. If their head drops. So just a low thing and watching him the whole time while he's doing that. I don't feel an impaction, but he definitely hasn't eaten anything. One of the things that we can do, so either I can send you guys home with some hand feeding and trying to get him started on just basically a liquid diet for right now, and try and get his energy back up, or we can hospitalize him for a couple days and do that here. Either or kind of works. You guys have a good setup at home, so I'm less worried about him as far as going back to suboptimal temperature zones or anything like that. So you guys have that, cared for. But I agree, he's definitely not normal and not feeling well, and that definitely indicated a prolapse, or at least a partial prolapse. He obviously was able to get it back in, but he probably did have some impacted feces. So whatever he laid this morning was probably him getting out what was causing him some discomfort and pain. But if he still has a little bit of sub-Q fluid to keep him hydrated, because if we are going to treat him with any medications and everything, he needs to be hydrated for all of that. So I'll give him that, and then we'll start him on feeding, and then we can start him on medications like tomorrow or something, just to give him time to make sure that he's well hydrated and